Spinal Truth Show Weekly Podcast Edition. I'm your host, Dr. Caleb Slater, here with a special guest this week, somebody who is near and dear to my heart, my wife, who is an expert in her field, as well as who has completed 2 marathons recently, which is great because this week we're talking about running. Welcome, Danielle.
Yeah, thanks for having me. I'm excited to be here again.
So this will be a good podcast for runners because they're going to get 2 very different opinions. Somebody who likes to run, and that's your outlet, and you've done marathons, and you think that's nice and good, and somebody who hates running, and if it's more than a mile, I'm going to drive there.
Yeah, probably more than a quarter mile.
Yeah, I mean, honestly, we need to get like a Segway or a golf cart, and if we lived in Florida, it's golf cart. Yeah.
Yeah.
So let's talk a little bit about, you ran 2 marathons recently. What were some of your takeaways as new to running a marathon and from your physical therapy perspective?
Yeah. So I was very surprised that as I gradually increased my mileage. I was following like a great plan.
You were following a program, you were doing it right.
Right, I wasn't just jumping into doing 10 miles without preparing for it. But once I started to hit around the 10-mile mark, I would notice that not during the run I would be fine, but afterwards I get in the car, be driving home, be sitting down at home, and I started to have pain down my leg. It was in the posterior portion, which is kind of like in the back of my calf, maybe where you would get a Charlie horse, but it didn't feel like that. It was like a toothache.
Okay.
And it would change depending on my position. So it was a lot worse. The worst thing I could do was driving. So if I it was only in one leg, stuck my right foot out to press on the gas or brake, it would start aching. And initially it was just there like 20 minutes, a half an hour, and I could get it to go away. And then a week later it was there an hour or 2. And then all of a sudden I'm noticing it every other day when I'm driving.
And what did you think was causing it?
My back.
That's what you thought at first?
Well, this was only 2 years ago, and at that point...
Don't lie to the audience here.
Yes, but maybe the triggering factor isn't as easy to pinpoint. I mean, if this was 10 years ago, no. I would have thought, did I have a muscle strain in my calf? What did I do? Because everything in my running program had been fine. Well,
and kind of going back a little bit, there's a lot to unpack from what you said, because a lot of what you said now, in the way that we know how the body works and how back pain is connected to your legs and stuff like that, it's really easy. And I bet you a lot of people out there are experiencing the same thing. You said that the worst thing you can do is driving, right? So it wasn't when you were running, it wasn't when you were using it, it was after. You said that it was changing. You said that it was also progressing. It was lasting longer and longer and worse and worse. You said that you couldn't stick your leg out. All of that to me means a nerve issue, a back issue, a spine issue. And it means that because there's some common signs that point to a nerve issue, and one of them is variability of symptoms. Sometimes it's there, sometimes it's not. The other one is symptoms at rest. If you're not using your body part, you're not using your calf, and your calf hurts, it's probably not a muscle, tendon, ligament, joint issue. And then the other thing that you said, if you're driving, and this is specifically with your right leg, if you're sticking it out, this is a nerve tension position, and a lot of people don't know this. So this is tensioning your sciatic nerve, and a lot of people that have a back problem, they realize that driving is one of the worst positions for them because they're constantly tensioning that nerve that's already irritated, and that's one of the worst things that they can do, but they don't realize that it's a back issue, a nerve issue.
Yeah, I mean, that's a test we use in PT 101 of diagnosing.
Right,
how to
put tension on the nerve, and if it's causing symptoms, then it's positive for some type of nerve involvement, and most of the time it's coming from the back. Now,
I think one of the interesting things that is really common is it wasn't during my activity. It's now going back over a year, but I don't remember having a pain during any of my runs. Like that area wouldn't bother me. But I would notice it was more consistently present the longer I ran, like post running.
So after you're done running, the longer that you've been running, the longer your symptoms would last.
Yeah, like typically with marathon training, you have a long run day. And then you might have some shorter runs and maybe a medium run. If I did like a medium, but especially a long run, that's when my symptoms started to become obvious enough that I couldn't ignore them.
And medium to you at this point was like 14 miles, right?
Maybe something around 8, actually.
8.
Where like maybe a shorter run day could be like 4 to 5.
Those short 4 to 5 mile jaunts. And at any time, did you have back pain?
No.
And this is great. So this is
Did
terrific.
not bother me at all.
This is terrific for the people at home. So many people think you have to have back pain to have a back problem. All right? You do not. And often you don't. You actually have a problem in your spine, a problem pushing on the nerves, and you have no pain in your back whatsoever. So you had no pain in your back whatsoever.
No.
None during your run,
Nope.
None after, but you were still having pain running down your leg.
Yep.
And then you believe you had...
And it wasn't like coming from my back, going down my butt, going down the back of my hamstring.
Line. Yeah, it was just your calf.
In my calf.
Just your calf.
Yeah.
Right. And so many people would think, number one, they'd go to a calf strain, right? They'd go to shin splints, and then they might even go to something like compartment syndrome. And those are going to get diagnosed. And the problem with them getting diagnosed that way is that then you're going to get treated, and the treatment isn't going to work, and your problem is either going to continue or progress. And as it progresses, it changes too. Like it was in your calf, now maybe later on it's more of in your hamstring issue, or maybe it's more in your foot issue, and now you start chasing those symptoms, and you didn't realize all along that you had a back problem. And what we're trying to get people to do, what we're trying to get people to realize is that earlier on in this journey, your back should be properly screened and attempted to be treated to see if it can change your symptoms. Because if it does, it was a back problem. But nobody else out there really looks at this like that, other than maybe McKenzie physical therapists. And so you're certified in McKenzie, right? I'm certified in McKenzie. What would a McKenzie physical therapist tell you to do?
Yeah, they would want to assess when I have my symptoms.
Okay.
To see what positions I'm in make my symptoms worse, make my symptoms better. Can I change my symptoms by moving around?
Okay, so but by that, running had no effect. Mm-hmm. Sitting made it worse. Mm-hmm. So what would a McKenzie physical therapist tell you to do?
Initially, they would probably say, let's try some extension.
Press-ups.
Yeah, press-ups.
Right. You're avoiding the word press-ups.
Picturing a cobra yoga pose or
right.
Upward.
They would do a press-up. When that didn't work, they do a press-up with hips off center. So they do it with a little bit of like a frontal plane.
Especially because I had one-sided.
Then they do it with overpressure. Then they do sustained. And then they'd kind of be flummoxed. Then they'd probably start treating it as an adherent nerve root, and they'd start doing like, I'm going to call it nerve gliding issue, but for the people at home, but like nerve remodeling. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. What did you do to make it better?
The complete opposite. So
what's the complete opposite of press-ups?
Lumbar flexion, which would be flexing, almost more like happy baby type, or standing and leaning forward to bend over. So flexion to my back ended up reducing the symptoms, but it came, and I think part of the importance is that I learned that I could stop them from happening by doing it before an activity, such as running, where I'm in constant extension.
Well, and so there you go. So I was just going to ask, why does it make sense that you needed to do flexion? So bending your lumbar spine forward, folding in half, bending down to the ground. Why did it make sense that you need to do that before and after running in order to make yourself feel or stay better? And the answer is that running is an extension moment of your lumbar spine. So it's arching your lumbar back over and over and over and over and over and over and over again. 8 miles, right? 8 miles, how many steps do you take in a mile? It's 5,280 feet divided by 3 for a step, right? So you're somewhere around like 1,700 steps in a mile. So 1,700 times 8. So now you're at 13,600 arching of your back.
That's impressive.
If I got that right?
To fact check that.
Yeah, we might not have got that right. Somewhere around there though, right? Arching your back over and over and over again with the weight of your spine, with the force, the load of you hitting the ground over and over and over again. And people don't realize that, again, that's fine to do, but you also have to undo that pressure. And a lot of times, this is another thing people don't realize, when you sit, your spine's actually stuck in extension. So a lot of people think that when you sit, you're slouching. Take a look at the next time you're sitting in a chair, or take a look around you at other people sitting. And I don't want to like categorize or generalize, but especially women seem to really sit up with like good posture. Guys tend to slouch a little bit more, but women in general seem to sit up with like this good posture, but they're stuck in extension. And if you never get your back out of that position, you will create problems as well. So
can I clarify a point that it wasn't like I was extending my back when I was running. We're just saying that naturally when you stand, your spine is into extension.
Yeah. So good
it's
point.
Just I was in that activity with the force of pounding and running.
Good point. So you weren't running incorrectly.
No.
But any type of running is an extension moment of your back.
Correct.
Additionally too, so like when you arch your spine, you stretch your hip flexors. Your hip flexors is attached to your lumbar vertebrae. When you bring your leg behind you, you stretch that hip flexor and pulls on your lumbar vertebrae, pulls your lumbar vertebrae forward. Then when you try to bring your leg forward, you contract that muscle in that elongated arched position, and you further tug on your vertebrae. So like over and over and over again, that muscle is tugging on that vertebrae in that position as well. So it's not even just the movement of your spine, but it's the contraction of the muscles in that movement as well. So, but in so many people, A, wouldn't have correlated your symptoms to your back, and B, when they did start to treat your symptoms because of what you just said, running was fine, sitting was worse, they would have had you start doing press-ups and extension, which is what caused it in the first place. And then the third group here would say that we categorize this as kind of a disc issue. I get so many people online saying you should never bend forward with a disc issue. So how do you explain that?
Well, that doesn't sound very functional. How are you not going to bend forward to do any of your activities of daily living? It'd be pretty difficult to imagine going through my day without ever bending forward.
Well, what if I have a herniated disc? Should I be bending forward?
Well, the herniation can go in many different directions.
Herniation can go in many different, you can have an anterior herniation, right? Additionally too, your vertebrae or the facets can be pushed down so far on the back that they're actually clamping down on the disc. Bending forward takes pressure off the disc, allows it to reduce. That's another possibility. And exactly what you said, at the end of the day, you need to be functional throughout that movement. If you are stuck in extension, when you bend forward, you use all of those lumbar spine extenders, all of those erector spinae, all those muscles in an extended position. All they're doing is further jamming your spine into extension. Versus if you're able to move at your lumbar spine, you actually get some movement of the vertebral column, the normal arthrokinematic movement, normal joint movement, right? So like, that's something you need. If you don't have that, you compensate above and below. You compensate it below at your hips, you compensate above with your thoracic spine.
Yeah, and I feel like generally I have a stiffer spine. As a PT, I should have known better to do preventative things, but I'm busy and I like to run, so I go and run. But when my body was giving me these signs that the more that I ran, the more I was noticing symptoms. Now, I didn't have any of these leg symptoms with driving prior to starting my marathon training. And doing those, identifying the right movements to do before my runs, eliminated it so that I didn't have any symptoms towards the end of my training or after I completed the marathon that day or any time after. And since I haven't.
Well, and so you say as a PT, you should have known better. I'll help you out here a little bit. And I have this example in my book, but I'm not just a PT, I'm not just an orthopedic expert, I'm the spine guy, right? Everything's coming from your spine, or at the very least, it should be checked first. But if you want to be hyperbolic or if you want to be a jerk about it, everything's coming from your spine. We had an issue, or I had an issue a few years ago where I was running, I was trying to train up for a Tough Mudder.
I remember this.
And I'm running and my leg's going numb. My leg's going numb, and I kind of felt like I had a little moment where I had like a pop, and that pop felt like a strained muscle. So I treated it like a strained muscle. Even though I had numbness when I was running, numbness and to the point where my foot was starting to like kind of slap, like, which is basically foot drop. I was losing control of the muscle. So I was having numbness and weakness, which is a nerve issue. But for whatever reason, it didn't categorize it at all. Or maybe I just ignored it. But then eventually I had like a pop that felt like a pulled muscle. I treated it like a pulled muscle. It wasn't getting better. The Tough Mudder day came. I just wanted to, grit through it. So I started running. Immediately as I'm running, I'm limping. I'm limping the entire race. And then all of a sudden, towards the last part of the race, my symptoms completely switched sides. And that's when I had an aha moment. I'm like, shit, it's my back. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
I feel like moments like those have gone into why your emphasis right now is it's the spine. Like, you've had so many of these experiences with your patients, with your wife, with yourself, that it just keeps coming back to the same driver, that the nerves, the back are often
involved.
Yes.
Maybe not necessarily the main cause, although that is the case more often than not, but at least involved. But the point is that even me, the spine expert, the person who says check your back first, when I had my symptoms, I kind of reverted back to what the typical approach. And I didn't pick up on it until one of the telltale signs is switching sides, alternating left and right, or being bilateral at the same time, being on both sides at the same time. Until that happened, it didn't trigger it for me to say, oh, it's my back.
You'd gone more than probably 20 years of your life with the medical system, even PT school, telling us pain is where you feel it, experience it, and treat pain where it's at, not even thinking about that as a classification. So
there's
it's hard to undo that like foundation and think differently. And I come across that all the time when I'm working with patients. Just that it's hard for them to kind of grasp this concept when they've heard the opposite for 20 years, 30 years, 40 years.
50 years?
Yeah.
60?
Yeah.
70?
Yeah.
You know what, so maybe what are some of the good takeaways from this? That's a great one. Where you have your pain isn't necessarily where you have your problem. Where you have your pain isn't necessarily where you have your problem. If you have pain in your foot, in your calf, in your knee, in your hip, in your shoulder, in your elbow, in your hand, all of those pains can be a problem in your spine, a nerve issue. It feels exactly like a foot problem. It feels exactly like a calf problem. It feels exactly like a knee problem or a meniscus tear, whatever. It feels like that. It mimics that, but it doesn't have to be there, and it should be looked at. It should be looked at You're not just that area where you have your pain, but where it could also be coming from. And we know certain areas correlate to certain areas of your spine, correlate to certain areas of your body. Your foot's L4, L5, S1. Your knees, L2, L3, L4. Your hips, T12, L1, L2. Like, this is pretty easy, right? So at the very least, have that looked at before you go down the rabbit hole of treating possibly the wrong area and possibly the wrong diagnosis. So I think that's a great takeaway. Another one would be if you're just sitting there and you're getting symptoms, it's also
probably not a muscle strain.
Probably not a muscle strain, right?
When I was resting, not using the muscle, it was bothering me. And it would hurt even outside of driving. We would just be sitting having a business meeting.
Walking, never walking. Yeah, me and you we were trying to go for walks a lot, and you were having trouble walking.
That was a different issue. Well, it was still a back issue.
It's still back.
But not at the same time.
Oh, all right.
Not at the same time, but yeah. I've gone through
Well,
my fair share of symptoms, but I can't be more appreciative that I'm in the field that I'm in and that I have the resources around me.
Well, I was going to say, like every good PT out there and every good doctor out there, you're shit with your exercises, with your own treatment.
Yeah. It can be tough to diagnose and treat yourself.
How about specifically for runners? I think a good takeaway from this is if you're getting numbness, tingling, or weakness in your legs when you're running, you have a back problem.
Yeah, and I would consider, for runners, think about that activity, like we said, you're in that sustained position where your back's in extension. So give your back some flexion. I've seen it with multiple other marathon trainers that I've come across since, where it seems to be a really important prevention and treatment is flexing your back before your runs, after your runs. So the more I was gonna go for a long run, or the more I was ramping up my runs, the more I'd be dedicated to making sure I did a little prevention.
Which is great. And knowing what to do and when to do it before and after, an activity that's gonna put you in that position over and over and over again. I mean, it's so simple, right?
It was so simple. I didn't need imaging. I didn't need
injections.
No, I didn't even need medication.
Yeah, you just had to treat the problem.
Yeah.
No way. Another thing that I kind of tell patients, this is to build off of your point, a lot of people, they'll do an activity. Let's say they go to the gym and they work out. Whatever, CrossFit, weightlifting, pickleball, whatever. They come home, they drive home, they shower, they eat, they sit down, they rest for a little bit, watch TV or whatever. They go to get up in 30, 45 minutes, and all of a sudden they're like, fuck, my back, I can't do that workout anymore. And I'm like, no, it wasn't the workout. You were fine with the workout. It was the position you maintained after your workout when you cooled down. So kind of building on, a lot of times you see a lot of people stretching their back out afterwards after they're running, and they're arching their back and they're doing twisting and stuff like that. And that's what you've done the entire time. When you've run, when you've worked out, your muscles, your joints and everything, it's about as loose as it's going to be. Now's the time to cool down in a position opposite of what you just did. So finding, you talk about that happy baby position, or just a position of a little bit of flexion to cool down in, to stretch into afterwards. That's so important. That's so helpful in undoing the stress that workout, that activity did. It wasn't the workout, the activity per se, but it was the fact that you never then got out of the position and then you cooled down in that position.
Yep.
What else? Do we have another takeaway for running here?
Marathon runners are plagued with injuries, right? It's a lot of tough work on your body. You're pushing yourself to the max. So just considering what you can do, the old saying of prevention, right?
And an ounce of prevention's worth a pound of cure.
Yeah.
Yeah, I think I got that right.
So I definitely advocate for anyone in that type of training to try to add something to their program that's going to help them get movement in something that is opposite from the position of running. So trying to add some flexing.
Which is such a simple, logical approach. And that's the approach that I take with my treatment philosophy, that we take Why don't other people do it?
It's a great question. I don't think there's an easy answer to that. I mean, there's a lot of fear of bending, which is kind of ridiculous because you do it all day long.
Chris, are you afraid of bending?
I haven't bent a day for the last 20 years.
Look at that.
I'm not on microphone, but I will say, you say, why don't people do it? But you just admitted earlier that you didn't do it.
Yeah, so it's fair. You know, it took me, as I was going through this, and like what you said, because I've had issues, my own issues, because I've had to solve my patients' various issues, it's led me to this approach. But even then, I missed it. Even then, you missed it.
Sometimes it's not as obvious, because if I'm telling you I'm having pain in my leg while I'm sitting, you're thinking, all right, well, what's going on when she's sitting? Stop sitting.
Yeah, and again, so for the people at home, the approach is, the first thing I do is I listen to all your symptoms. I listen to what's going on, how long it's been there, how it behaves, what it looks like. Is it pain, numbness, tingling? Where is it at? When is it not there? When is it there? The next thing we do is we look at that area. If you say you have a foot problem, we look at your foot. We see how it moves. We see how you squat. We see what you have symptoms with movement. But then the next thing we do, before we do anything else, is we look at your spine. And the reason we do this is because it's not obvious. And I have so many PTs that reach out and they're like, I always screen for cervical radiculopathy. No, you don't. And if you do, you don't do it well. It's not obvious. It's not obvious. And the best way to see if it is there is to examine it and then maybe even do just a little bit of treatment and see if it changes your symptoms. And so many times it does. And it's so frustrating. And that's why this method came about. Because it's not just sometimes, it's not rare, it's not 50% of the time, it's like 95% of the time, the spine, the back is at least involved, if not the underlying cause. And the more I looked for it, the better I got at finding it, and the better my patients got. And now, if you need to treat the local area, the local joint, the local musculature, now that you've taken pressure off the nerve, you've taken pain away, you've restored the nerve signal, the ability for that muscle to contract, now any treatment that you do at that area is more effective. There's the approach. Makes sense, right? So why isn't it adopted? Next week, Danielle will answer that question. So that's our show. Hopefully we answered some questions about running. If you have any other questions, you can reach out to us on this YouTube channel. You can reach out to us on TikTok, Instagram, Facebook, and probably somewhere else. So I think we're on Lemonade now. And just in case TikTok goes away, head to Lemonade. We will see you next week. Thank you for joining.